Thank you, sir. Thank you so much. And good afternoon, everyone, especially dear students. My name is Dr. Rashmi Jindal, and I'm working as professor in Himalayan Institute of Medical Sciences, Dehradun. I have been in an institutional practice for the past 15 years. Now, I sincerely don't know if I am the right person to address all of you. I'm not an expert in the field of dermatology nursing, and I'm really humbled and honored to be here with all of you today. I can't thank Dr. Narhari sir enough for giving me this opportunity. He and many of our senior IADVL members, Dr. Lakshmi Nair, Dr. Vineet Kaur, they have so much passion for this field and they have been working extensively, even collaborating with the international societies to establish this important subset as a subspecialty in nursing curriculum. Now, I really look forward to meet Sir soon and learn from his vast experience. We all know that nurses are someone who nurse a patient back to health. They be with him throughout his illness. They support him emotionally and counsel him appropriately. The emotional connect that you have with the patient is very pure, and that's your strength. I remember when both my children were born, it was the nurse who held my hand, who helped me manage that overwhelming situation. And I can never forget her. And I think that connect is what makes you special. That is something that you can utilize for helping your patients. I have a very dear friend, she's 90 years old, and she worked as a nurse in America for a very long time and then relocated many years back to India. We talk a lot about how the Western culture is different from Indian culture. Their nurses are clinical assistants. They work with the doctor and not under the doctor. You know how this, a little change in the preposition changes the whole equation. And this is what we need to bring. There is a major change that we need to bring in our healthcare system. Our nurses have to be an essential part of our team. They don't have to just follow what the doctors order. They don't have to just give tablets or injections to the patient. They have to participate in decision making. They have to voice their opinions for the benefit of the patient. I'm happy that very slowly this change is becoming evident. We Indians are very slow in this context particularly, but I'm really positive that we will reach there and we will stand hand in hand with our nurses. Now, talking about the scope of dermatology nursing, it's immense, it is huge, it's unimaginable. Be it cosmetology, be it dermatosurgery, or just clinical dermatology. We need you everywhere to help us with the procedures, to help us treat the wounds or infections that the patients have, and most importantly, to provide education to our patients. Now, dermatology nursing is not as fast-paced as probably emergency or the critical care. So it gives you a lot of time. It gives you a lot of time for your personal growth. You can give that time to your family. You can have a little more relaxed schedule. And isn't that something we all want? We all strive for a little more relaxed schedule in our life, given the stress of the day-to-day life. If you want to have a 9-to-5 practice, yes, you can have it. Still, you can have the same satisfaction that you will get probably by working in a critical care setting. Now, dermatology diseases are a little different from the other common diseases, medical diseases. You cannot look at a patient and tell that the patient has got diabetes or maybe that the patient is hypertensive. But a patient of psoriasis, a patient of vitiligo, a patient of eczema, they can be identified from far. People around are not always very accommodating. And this affects the quality of life of our patients to a very great extent. They feel embarrassed, they feel anxious, they feel stressed, they feel depressed. As doctors, probably the time that we can spend with them is limited. We do try and alleviate their stresses, their queries, But here is where all of you can help us. The connect that you can establish with the patient is far beyond our capabilities or our capacities. You can answer their questions, you can offer emotional support to them, you can guide them so that they are more relaxed and they are more confident. Now, I work in an institution. We see patients day in and day out. We see emergencies also. Whenever I talk to my first year postgraduates, the moment they join, that you have to bond with the staff, you have to bond with the nursing staff, because even more than us, they are going to teach you. The success of any patient, be it toxic epidermal necrolysis, be it drug rash, be it erythroderma or some extensive vesiculobullous diseases, it depends upon the efficient nursing care. Not only in the wards, our patient, the outpatient department also, and even in the procedure rooms also, we need your help. You are the backbone of any good clinical practice, any good dermatosurgery practice, any good cosmetology practice. So the avenues are huge. There is vast scope. You can specialize in any area that you want. If you feel you are good for clinical practice, you have a knack for counseling the patients, then that is the area that you need to focus on. If you have a good surgical hand, then you can focus on dermatosurgery or a cosmetology practice. We are now talking about the task shifting, that is shifting of the clinical task from physicians to non-physicians, healthcare workers. Now, the biggest resource that we have available is the nursing staff. And especially in resource constrained settings like ours, this task shifting will be an effective means of increasing access to dermatology services. Now, we know that there is shortage of dermatologists. We have less than one dermatologist per 1 lakh of our population. So here is where your help will be really immensely helpful. It will be a very welcoming step. So the need of the hour that we recognize dermatology nursing as a subspecialty. We develop a structured curriculum and we utilize the help of dermatology nurses in institutions, in clinics, as well as in the community. We at IADVL are trying to revive the interest in this field, and with the help of support from Dr. Narhari sir and whole of the dermatology nursing task force, we hope that we'll be able to come up with some specific training modules that will be really helpful. And I really sincerely want all of you to consider dermatology nursing as a prospective future career, and believe me, you will never regret it. Now, sir talked about the opportunities available. Whosoever is having a dermatology practice, they will need you. If you have, we have very less nurses who are trained in dermatology. If you are trained in dermatology, best of the doctors. If you have a certification for that, I don't know how much in Western countries, they have proper courses available. We are lacking in that sense. And probably sir has worked a lot in this field and he has special passion. We have talked about this, that we should be talking to the Nurses Council about bringing about a proper curriculum. And once that is available, I think then will be a time that the job opportunities that you all will get will increase, and you will be able to work with the doctors for the patient and also give some time to yourself and your family, because that is how the field of dermatology is. So I think that is all that I can say, and I hope I was able to do justice to whatever the task was given to me. And I seriously, sincerely feel that this is a real opportunity that has been given to me. And thank you, sir. Thank you for this wonderful opportunity. It was wonderful to interact with you virtually. Thank you.